Welcome to Tell Me Some More with me, your host, Dr. Shiva, clinical psychologist and curious human about all things emotions, relationships, connection, and growth. My mission is to help you in improving your self-confidence and your relationships, both with yourself as well as with others, and to increase your awareness around the topics that actually matter in order to live an intentional, fulfilling life. Each week, I'll be releasing one episode that will either be a solo session with me or a conversation with an expert in a different field. While I hope that you find this information helpful, it's not intended to be a substitute for mental health or medical treatment or professional advice. Now let's get curious and help you to have more of the life and the relationships that you desire and so deserve. Enjoy, everyone. Hi, thank you so much for joining me. I'm so happy to have you on. For everyone who's listening, this is Dr. Kiran Mian, is a board certified dermatologist who will be joining us today. And so I'm so happy just to be talking with you today.
Thank you so much, Shiva. Thank you for having me. I'm really excited to be here.
Oh, thanks. Well, I would love if you could just introduce yourself and share a little bit about your background and the work that you're doing, and then we can dive in and focus on the questions.
Yeah, of course. As you said, I'm Dr. Kiran Mian. I'm a dermatologist based out of New York City. I practice medical and aesthetic dermatology here. I've been practicing for about 5, 6 years now. And, I would say my philosophy is more so kind of science over trends. I mean, skincare should be fun. It should feel good. You shouldn't feel like you're chasing something.
Mhm.
When it comes to my aesthetic procedures, I really strive to make my patients feel like the best version of themselves. That's sort of our goal in the room. So yeah, my philosophy is a little bit more holistic, I would say. I
Mhm.
talk a lot about nutrition and exercise and just my patient's lifestyle when we're coming up with a plan for them. Um, and I love it. I think I knew day one of medical school I wanted to be a dermatologist. So
Oh my gosh, no, I love it. And it's so wonderful. Just seeing you on social media, and obviously we know each other personally, but just seeing you on social media and the work that you're doing. And and thinking about having this interview and this conversation, I thought of you because I really do just love how you do really focus on holistic, just dermatology, right? And helping people to feel better, but in a really natural way. And I think that definitely comes through the work that at least I've seen on social media and just who you are.
I'm
Um,
glad it does. I'm really
yeah.
glad it
No,
does.
no, of course. And I think, and when we're talking about skincare, it's just, it is one of those things, at least in my experience, where it's been so overwhelming. Like, I've never been the person to use different skincare products, to even know what to use. Like, I'll usually be asking friends because it's just, there's too many different products and there's too many trends. And so I would just love if you could share, like, what are the basics? What are the things that in general we need to have healthy skin, and like skin that hopefully can prevent, more preventative as well. So both to take care of our skin, but also to help us with premature aging.
Yeah, for sure. So there's so many ways that we can take this question. I'll start with this. Protect your skin from the sun.
Yeah.
And I know it's like beating a dead horse. Every dermatologist says that. It's like when people tell you to sleep early or drink 8
Yeah.
glasses of water a day or whatever. Like we know we're supposed to do it, but nobody does it, right?
Yeah.
But it's really true. The sun emits UV rays and that damages our skin. And ultimately, when it comes to aging or losing collagen, losing elasticity, fine lines, wrinkles, even pore size enlarging,
Mhm.
increased texture, all of that comes from the wear and tear of our skin. Our skin is an organic living organ. It's the largest
Mhm.
organ of our body,
Mhm.
and it gets affected by the environment. It's literally like, imagine like your heart and your lungs and your stomach. Like they're inside, they're protected, they're encased by things. Your skin is an organ just like that, but it's on the outside.
Mhm.
So it's up to us to really protect it and take care of it so that it can function and do its job. So the number one thing I would say is to wear sunscreen, and keep this in mind that the sun damage is cumulative. It's not like, oh, I go to the beach and I wore sunscreen, I didn't get burned, great, I'm good. Like
Mhm.
that's great, but you want to wear sunscreen every day and protect your skin from the sun all the time, because it's that cumulative exposure that builds up that we then see as we age. And
Mhm.
so even going to the grocery store from your car, you're walking, sun is beating down, you're exposed to the sun, and all of that exposure accumulates over time.
Hmm.
So definitely wear sunscreen, your whole life, starting as a kid until adulthood. You always want to wear hats, long sleeves, protect your skin from the sun as much as you can.
So no
So
tanning.
that's one thing. The other thing is,
No, I was gonna say I don't know if you heard me. It did cut out for 1 second, but I was saying so basically no tanning, or be safe when you are tanning. Like where
well,
be
it's so funny because my patients will be like, they'll come back from, let's say Miami, and they're like, oh yeah, I wear sunscreen, and I'm doing a full body skin exam, and I'm like, I see your bathing suit, like you're tan, which it's impossible to not get tan, right?
yeah.
You just want to do your best. You
Yeah.
don't want to fry, basically. So
Yeah.
you're going to get some color. That's okay. But you really do want to, protect yourself as much as you can. Keep in mind that although that bronze skin looks beautiful,
Mm.
it is getting damaged with that sun exposure. And so using self tanners, I'm a big advocate for self tanners,
Mhm.
bronzers, things like that. To kind of give you that sun-kissed glow. And over the summer, you will get a little bit of color. That's okay. But overall, we want to do the best we can.
Yeah, of course. And I guess and I would imagine this varies depending on the person and their skin tone, but in general, what kind of SPF should we get? Like how high should it be?
Yes, that's a really good question. So I suggest SPF 30 because anything
Okay.
above that, 50, 80, it's sure it's great, but it gets thicker, right? It gets harder to
Mm.
use. And the actual protective factor is negligibly higher. So
Hmm.
SPF 30 is like 96 point something percent effective. So
Oh, wow.
anything
Okay.
above that is like incrementally higher. So I say SPF 30 is great for the face for everyday use. If you're going to the beach, sure, for the body, get like a thicker one because that will stay
Hmm.
on better when you're sweating and in the water, things like that. But SPF 30. And the key is to reapply. One thing that people don't know is that sunscreen only lasts for about 2 hours.
Yeah.
So it's like,
Okay.
okay, I'm supposed to apply 2 finger lengths on my face every 2 hours.
Oh
It's
my
hard.
gosh.
It's
Yeah.
hard. And that's why you do the best you can because you're never going to be perfect, right? And
Yeah.
so that's why wearing hats, sitting under an umbrella at the beach, wearing a cover up when you're not in the water, things like that will help because sunscreen can only do so much.
Sure, sure. Okay, that's super helpful. And sorry I cut you off, but you were so in addition to sunscreen, what are like the other essentials that we need for
Yeah,
healthy
so the
skin?
basics. Wash your face,
Yeah.
just wash it before you go to bed, please.
I love
That
how when you say that that is a basic, but I will tell you, I mean, I'm guilty of this. I'm just getting into the habit of like there are nights where when I was much younger, if I had a face like just had done my eyes, whatever, I just was really tired. And so I would
I
sleep with it. And now as I'm aging, I'm like, oh, I can't be doing this anymore.
I would do the same thing when I was young. Now if I do it, I wake up with a pimple guaranteed. And I'm forgot to take my makeup off. Yeah, you just want to clean your face every night before bed. What I suggest is to do it at dinner time because
Mhm.
by the time you eat dinner and you're watching Netflix or whatever, and it's time for bed, you're sleepy, right? You just want to
Mhm.
crawl and move from the couch to the bed, and that's it. I suggest doing it after dinner so that you're still a little bit awake, you have some energy, and you remember to do it.
Okay.
That way you make sure that it gets done. So
Okay.
just cleaning your skin, making sure that it's clean before going to sleep. When you're sleeping is when our skin goes through its regenerative process. So you want to make sure that it's nice and clean so that your skin can do its thing, repair itself overnight while you're sleeping. And that's why
Okay.
sleep is so important for skin too, you know. But basics. So sun protection, cleaning your skin every day, and even if you're not wearing makeup, so some people think I don't wear makeup, I don't need to cleanse. You have the day's dirt, oil,
True.
debris, environmental pollutants, everything sitting on your skin, dust, all of that. So you definitely want to wash with just a gentle cleanser.
Okay.
You don't want to scrub because that will cause more irritation, but just a gentle cleanser. Make sure that your skin is clean before going to bed, and moisturizing. So our skin is made up of 75% water. You need to apply moisturizer no matter what skin type you have, whether it's oily, whether it's combination, oily T-zone, whatever it is. You definitely want to wear a moisturizer because your skin needs water.
Hmm.
Oil and water are two different things, right?
Hmm.
So even if you have oily skin, you still need to wear moisturizer. So I would say those are the three basic things, right? Sun
Okay.
protection, clean, moisturize.
Okay. Okay, no, this is all great. And these are all things that we can all be doing, regardless of your age. Like we want to be prioritizing these three things. How about
Exactly.
what are sort of things that we should start considering as we're, hitting our 30s, our 40s to prevent aging? And that's really the time that I've started to think about, my skin, to be honest. And so what are the things that I really need to be looking to?
Yeah, definitely. So now that we get older in our 20s, 30s, now is when we start to lose our collagen. So naturally, just a
Hmm.
part of aging, we lose about 1% of collagen a year. So what that means, collagen is what gives our dermis, that second layer of our skin, the meat of our skin, you could say, the thickest layer. That's what gives our skin its strength. It's made of collagen. When we lose that collagen, that's when you get wrinkling. That's when you
Hmm.
get sagging. That's when you get those fine lines. Our
Hmm.
pores are held together by collagen and elastin, another fiber. That also denatures over time. And so our pores start to enlarge.
Hmm.
What you want to do to prevent that from happening is a few things. Number one, sun protection. We talked about that.
Hmm.
And then the two other things would be the big R word, retinol, right?
Hmm. Hmm.
Retinol and some sort of antioxidant. And I say that because the environment has pollutants, it has free radicals that sit on our skin and cause free radical damage, leading to damaged collagen. We want to use some sort of antioxidant to combat that damage.
Hmm.
I really like vitamin C, vitamin E. There are other antioxidants you can use. I like to make sure I'm incorporating a lot of that in my diet as well.
Hmm.
So berries, raspberries, blackberries, oranges, citrus fruits, right? Um, so antioxidant and retinol. And
Okay.
we can talk about what retinol is and why it's so important.
Sure. No, I would love to hear. I mean, I've obviously heard of it, but I have no idea why it's so important. So tell me.
So going back to that collagen, that's what we're losing. That's what we need to maintain. We need to restore. In order to get our skin to stimulate collagen production and maintain it, that's what retinols do.
Mhm.
So what you can do every day as part of your skincare routine is use a gentle retinol. I say gentle because retinol increases skin cell turnover, it can cause a little bit of dryness. And so that's
Mhm.
why, even just the other day, I saw online people were saying, don't use retinol, it's so harsh. There's so much misinformation out there.
Yeah.
It's not that it's wrong, but everything is nuanced, right? You
Mhm.
can't say once something is good or bad, right?
Mhm.
Retinol is really good for your skin. You just have to know how to use it.
Mhm.
It can cause a little bit of dryness. And so you want to start with a low percentage. You want to start with maybe something that's available over the counter. So there's different compounds within the
Mhm.
retinoid sort of family umbrella, right? So you want to start with one of the weaker ones and then slowly work your way up.
Okay.
And what retinols do, they increase skin cell turnover, meaning your skin starts at that bottom layer of the epidermis and then it works its way up and gets shed off. That's like the normal skin cycle. That
Mhm.
happens about every 28 days. But as we get older, that process slows down. And so you get dead skin cells kind of building up on top of each other. Retinoids help to speed up that process. So it helps to kind of renew the skin faster.
Mhm.
That's why
Mhm.
you get a little bit of that peeling in
Yeah.
the beginning. And that's normal. Your skin will get used to it and that peeling will stop. And of course, you want to wear moisturizer to help you get through that hump.
Mhm.
So that's one thing retinols do. They also help to stimulate fibroblasts in our skin. Those are the cells in the dermis that make collagen. And so that's
Mm.
why it's anti-aging. That's why it's anti-wrinkle. It helps to keep the surface of the skin nice and smooth.
Mhm. Okay. And so and when you so the collagen piece, what do you think about the supplements? Because there's collagen. I mean, I even have, I like love collagen for other reasons just because of the protein source, but does
Yeah.
it really help with our skin as well? Or is it not unrelated?
Well, jury is out on that one. There are many different brands that have come out with their collagen powders, and unfortunately, right now, the studies that have been done by those brands.
Mm.
So there is not as much sort of independent clinical data that we have, randomized controlled clinical trials that we have to significantly show that there is, an improvement by taking collagen supplements.
Mhm.
Some people say that it helps. Some people say that, the collagen molecule is so large that once you're ingesting it, it just gets disintegrated in your stomach anyway. And is it ending up in your skin?
I see.
I don't know. I have anecdotally, I've heard some patients say that they have noticed a difference when they
Mm.
take their collagen supplements, and some say that they haven't noticed anything. I personally haven't even tried them yet.
Oh.
I should. it's just, so many things to try. There's
There's
so
just
much.
so much. No, there are literally so many different products. And I think that's the overwhelming piece. And so I really do appreciate you sharing all of these, just, your recommendations, just because I feel like there's just so many different products, even with collagen. I feel like there's like the liquid ones that are super expensive, and there's the powder
Mhm.
one. And it's like, well, is there science behind this? Who
Yeah,
knows?
yeah.
So yeah, no, this is super helpful. And what were you gonna, sorry, you were gonna say something?
No, no,
No,
it was
yeah.
breaking up a little bit.
No, no, yeah. So, and then as far as, so outside of like products and things that we can do, of course, to like take care of our skin, you mentioned just food, right? So getting like blueberries and just fruits and trying to get in the antioxidants through that. What are other things that people can do if you just want to focus on maybe your nutrition?
Yeah. So I think what triggers a lot of skin conditions is just inflammation in our body,
Mm,
right? So whether it's eczema or acne or rosacea, it all comes down to inflammation. So to me, decreasing inflammation when it comes to your diet or in your body is
mhm,
decreasing sugar. So sugar is delicious and evil at the same
mhm.
time, right?
Right.
So sugar increases inflammation in our body. You want to decrease refined sugars, right?
Mhm,
You want to focus on natural sugars that you get from fruits and try to decrease, chocolate,
mhm.
candy, all of that.
All the good stuff.
All
Decrease
the
all of it.
Yeah, you know, as you sort of make your diet more healthy, your taste buds change. Like
Hmm.
now, when I drink soda, because I gave up soda like a long time ago, and now when I drink it, it's so sweet. Like
Hmm.
it's I don't even like it anymore. So
Right.
I do think that except with pizza, you have to have Coca
Yeah.
Cola. Anyway, so decreasing sugar and increasing fiber. So that's
Mhm,
one thing that one of my really good friends, she's a dietitian, Abigail Rappaport, she told me that if you increase your fiber, it kind of combats that sugar.
mhm,
So I really have my patients increase the fiber content in their diet. Sweet potato is great, green leafy vegetables, whether that's broccoli, cauliflower. I love sweet potato. I think it's a great way to get fiber
mhm,
in your diet. Avocados are very high
mhm.
in fiber. That will help to decrease inflammation.
Okay. Okay. And then
In addition,
water. Yeah.
water, of course,
Yeah.
yeah. So water makes a huge difference. Our cells are, like I said, 75% water, and you really want to make sure that your body is getting adequate water so it can flush itself out, right? Like our
Mhm,
lymphatic system is our system that basically takes all the crud and gunk and leftovers, byproducts of our metabolism. It takes it out of our blood and it takes it to the liver so it can get metabolized
mhm,
and, get rid of it. That can't function properly without enough water, right? So it
mhm.
gets sluggish. So you want to make sure that you're maintaining hydration in your skin
Sure.
or in your body for that reason, and many other reasons. What other foods? I definitely good protein. So you want to have
Mhm,
lean protein and healthy fats.
mhm,
Our skin has a lot of fat component and a lot of protein component. So I like salmon, chicken. If you don't eat meat, of course, there's plenty of ways to get protein with legumes and beans and chickpeas and
mhm.
things like that. So good amount of protein in your diet, 1 gram per pound, I believe, and then and healthy fats. So
Okay.
walnuts, again, salmon, avocado, omega threes. You want to
Mhm,
have high omega threes, low omega six.
mhm.
So that's kind of what I go through with my patients.
Okay. Okay. Well, thank you so much. And so how about as far as and then I do really want to dive into just your experience as an entrepreneur, but Botox, like tell us about what is Botox? Is it really true that it is good for prevention? I actually, when I would hear that, I'm like, no, people, that is just a marketing ploy. They're trying to say it's for prevention. And now I'm hearing maybe I was wrong in that perspective. But yeah, if you could just tell us, what is Botox? Is it really good for prevention? And when should people really start considering that as an option?
Yeah. Well, it's good that you thought that, it means you have like that analytical mind, right? Like you don't just believe what you hear. So that's really good. But it actually is true. Uh, Botox is, firstly, Botox is a brand name. So let's get that
Okay.
out there. It's kind of like saying Kleenex, right? So there's
Oh,
different
okay.
brands, but for simplicity, we'll, refer to it as Botox. That's kind of the main one, the most popular one, I think. Botox is a neuromodulator.
Mm-hmm.
It's a protein that sits on top of receptors in our muscle to prevent that muscle from contracting.
Mm-hmm.
That's important because when we have movement, right? So let's say like we raise our eyebrows and we get
Mm-hmm.
the horizontal lines across our forehead. When we stop raising our eyebrows, typically those lines go away. But you'll
Mm-hmm.
notice as we get older, as that collagen denatures, those lines that form with movement, our dynamic lines, become static. They're there even when we're not making that movement. And so with repeated movement, these lines start to form, the number 11s between your eyebrows, crow's feet at the corners of your eyes when you
Mm-hmm.
smile. So when you use neuromodulators to relax muscle movement, it helps to prevent those lines from forming in that strong of a way, and thereby preventing those lines from turning into permanent creases, essentially.
Mm-hmm.
So that's why we say Botox is preventative. It is. Once you have that crease and it's there, you can use Botox to prevent it from getting worse, but it won't necessarily go away because it's there even when you're not moving, right? So
Mm-hmm.
Botox relaxes muscle movement. It's all
I
about
see.
smoothing out the lines that form with movement, with expression.
Mm-hmm.
Now, when people say like, "Oh, she or he looks crazy, it's too much Botox or whatever," Botox is completely dependent on dose and placement. So it's very, very precise. It wherever you place it, let's say you put it right here on your forehead, it will migrate about 2 millimeters around that.
Mm-hmm.
So
Mm-hmm.
like that, right? So it's very precise in its placement. And it all depends on how many units you put. That's how it's measured, and we call it units. So if you put a lot of units, you will freeze that muscle. If you put a
Mm-hmm.
little bit of units, you'll soften that muscle movement, but it won't be completely frozen. So you'll
Mm-hmm.
still have natural expression. And
Mm-hmm.
so I have a conversation with my patients, how much movement do you want? Are you going for a natural look, or do you want to be, kind of very minimal movement? Now, if they want minimal movement, I would say like my approach is a little bit more natural. Naturally,
Yeah.
my aesthetic is such that, I think we should still be able to have some movement. Some lines are normal, right? Like
Right.
you
Totally.
can't be 60 and not have any lines. I mean, then you
Yeah.
feel plastic. So, um, we want to, nobody's trying to stop aging. It's a
Yeah.
privilege to age, right?
Yeah.
Nobody's trying to stop that. We just want to look like the best version of ourselves at whatever age we are.
Mm-hmm.
And that, I think, is what I really try to kind of express to my patients and drive that point home. I say no. Like my patients want, let's say, too much filler or Botox. I'm like, no, I'm not doing that. It's not
Right.
going to look good, or you don't need it, right? Like, um, I mean, nobody needs any of this stuff, but we all want to just look and feel our best.
Yeah. Yeah. So if it's going to help you in feeling that way and, just feeling a little maybe more youthful or refreshed or whatever, maybe then that's something to consider. But it sounds like when lines start to like present themselves, that would be the time to reach out to a dermatologist for
Yes.
consultation. Okay.
Yeah, I say when your dynamic lines are starting to become static,
Okay.
meaning when the lines that form with movement, when you're not making that movement anymore and that line is still there, you can see it, that's when you want to start.
Okay. Okay. Well, thank you so much. I feel like I've learned so much in like the last 20 minutes with you. You are brilliant. And so helpful. But okay, so let's transition out of skincare and just I would love to just hear a little bit about your experience as a physician in dermatology, as a woman in medicine. You are doing so incredibly well. And so I just would love to just hear a little bit about how has it been for you as a woman in the field of medicine and maybe some of the challenges that you've experienced in a
Yeah,
male dominated field.
yeah, yeah. Oh, where to begin?
Yeah.
So what I'll say is this. I think what I'll say is this. Women are really good at multitasking.
Hmm.
Men, not so much. I'm going to generalize and say that. Men tend to be more kind of single focused, right? Like they focus on their careers and then maybe think about having a family or whatnot. Whereas I feel like women are kind of better able to handle, juggle different things at once. And I think that being in medicine, that was an extreme advantage. So I love being a woman in medicine because I feel like I can take my femininity, my nurturing nature, and utilize that to help society, to help my community.
Mhm.
And so
Mhm.
I really pride myself on being a female in medicine.
Mhm.
Was it hard? Did it have its challenges? Yeah. I mean, I talked to my girlfriends about, like, 1 week out of the month, like, we're bleeding and
Mhm.
doing everything that everybody else is doing.
Yeah.
And like, we're in pain, it's crampy, it hurts, we're, bloated, like whatever it is, but you still have to just show up and be at your
Power
best
through.
all the time.
Mhm.
And women have a lot of pressure in that sense. There's also the added pressure of time and, biological age when it comes to family
Mhm.
goals. So some people are, lucky enough that they find their significant other, whether that's in medical school or residency or whatever it is. But other people not so much, and so you are so focused on school. And like, my medical school class had 150 kids in it, right, and half of
Mhm.
them were female, so that leaves
Mhm.
you with 50 males, right? Like, if you're a
Mhm.
heterosexual. So
Yeah.
I mean, out of those, who are you going to choose, right?
Yeah.
And you get into residency. My residency had 3 other residents besides me, right? So it's,
Yeah.
and then you go out into the real world, and you're like, wait, I'm in my mid 30s, and people start calling advanced maternal age after, what, 35, or whatever it
Mhm.
is. So being a woman in medicine definitely has its challenges, but I wouldn't trade it for the world.
Mm.
I love what I do.
Mhm.
Makes me cry. I love what I do.
Oh,
So yeah.
that's
Um,
so beautiful. Yeah. And
what else?
no, that is so beautiful. I mean, it's so wonderful. It's actually, Kieran, it's so beautiful to hear, because I feel like I don't oftentimes interact with people who really truly love what they do, right? Like, I think so often people pursue careers because, even I think within our cultural communities, at least within the Iranian community, oftentimes I'll hear, the pressure to become a doctor because of your academic achievement, where you'll be professionally. And so just to hear that, and it is evident that you really do love what you're doing, it's just heartwarming. And so it's what a blessing to be
It
to able
really
to
is.
do that
I
day in
feel
and day out.
so lucky in that regard that I found what I love to do, and I get to do it for a living. Because
Yeah.
you're absolutely right. Not everybody gets that privilege, that blessing.
Yeah.
And yeah, in our culture, it's seen as like a very noble profession, right? Like, our parents, being immigrant parents, for them, it's like
Hmm.
being in medicine is kind of guaranteed safety,
Hmm.
guaranteed kind of, you'll have a pretty good life, financially, security, all of that. Like, you'll always have a job, kind of thing. And so, yeah, I was definitely encouraged by my parents to pursue medicine. And I remember fighting with my dad, being like, well, what if I want to do something else? Just
Yeah.
being rebellious. I love science, but
Yeah.
I remember in undergrad, I decided to become a lawyer, and I majored in poli sci. And then a lawyer said to me, like, well, do you like paperwork? And I was like, no. And he's like, then you should not be a lawyer. And I was like, okay,
Right.
never mind, I'm not doing it. And I just went back to science. And yeah, I really love it. Business, though, like,
Yeah.
once you become a physician and you get out into the real world and you realize that, yes, medicine is what we practice in the room with the patient, business is what we're doing the rest of the time.
Hmm.
So
Hmm.
that was a whole other learning field that we had to go through. Medicine is very structural, so
Hmm.
you're told exactly what classes to take,
Right.
exactly when to take them, and then you're done. And then you have to figure it out. Like, how do you
Right.
negotiate a contract? How do you, what are the benefits that you ask for? Does everyone get a 401k? Like, things like
Hmm.
that. Like, no, we don't learn any of that in medical
Hmm.
school. And so figuring all of that out, how to manage your staff, how to, deal with, let's say, a difficult employee or a situation that happened
Yeah.
to patients. A lot of patient management is customer service.
Yeah.
I'm sure you see this too. It's about making sure that the patient has a good experience, and that's
Yeah.
not just treating them medically and helping their ailments, but also, as soon as they walk in the door, what is their experience like until they leave? And once they've left, did you follow up and make sure they
Right.
had a good experience,
Right.
that they got their medication, they were billed correctly, all of those things.
So how did you, I mean, you're bringing up so many great points, and I also agree with you. I think when I look back on my graduate experience, um, we didn't get, at least in my program, maybe other programs got this training, but I anecdotally, like, I feel like they did it from what I've heard, but um, we didn't get any training on like, how do you run a practice? How do
Yeah.
you, similar to what you're saying, like, what do you do, as far as like to be able to, you know, have a practice that's lucrative, right? How much you charge people? What does that look like?
Mhm.
How do you collect payment? Like, there were a lot of things around business and money in general, that I think we didn't focus on at all. It was definitely way more on the clinical side. But I also feel like, and I don't know if you felt this way, but I think my experience being an Iranian American woman made it even more challenging for me to negotiate, these pieces
Yeah.
of having my own practice, of talking about payment, of identifying how much I was going to charge per session. Did that feel comfortable for me? And
Mhm.
I think the part is, culturally, I initially, at least starting off early on in my career, like, we have the Farsi word like tarof, like where someone may, you want to initially say like, no, it's okay, you don't need to pay me, or you don't need to pay that much if you don't want to pay that much. You know what I mean? Like, so it was a learning curve in that way. Like, I was like, well, no, this is a service. I have a personal relationship, or I'm
Yes.
developing a relationship, but it's still a service. So I think definitely those cultural pieces influence my level of comfort in being a businesswoman, but also I
Hmm.
think my own mindset of feeling okay to charge a service that
Hmm.
my male peer counterparts were charging the same amount or even more.
Yeah.
I had to sit in my own discomfort of like, Shiva, objectively, you can charge this fee, or you can charge this much to do this thing,
Yeah.
and just be a little uncomfortable and see what
Mhm.
happens.
Mhm. Yeah, that's what I was going to ask you. Do you think that, the cultural aspect is one thing, and then the gender aspect is
Yeah,
in addition, right? Like, do you
yeah,
think that men feel that same discomfort asking for, and I think it all comes down to value. Like,
yeah.
how much do you value yourself, and how much are you comfortable with speaking up for yourself, knowing your
Right.
worth? Like, why is it that females don't feel as comfortable asking
Mhm.
for what they are clearly worth compared to a man?
Right.
I don't know the answer to that. Is it because when we're young, we're told like, oh, be a nice girl, right?
Mhm.
Whereas boys are like, when they're rambunctious, it's like, oh, he's just being a boy, And then
Yeah.
as you grow up, that turns into, as a man, he can be sort of bigger and forward and
Mhm.
even, I guess, like aggressive, you could say.
Mhm.
But as a woman, we are, taught to be polite and
Yeah.
bend for people and, be agreeable, right? And so you feel uncomfortable, kind of, it almost feels like a confrontation
Yeah.
asking someone to pay for the service that you are providing them.
Right. And to be, yeah, absolutely. I mean, I think there's so many different reasons for it, but I do agree with the points that you've shared. I think, the nice piece, or not, not being a burden to other people. Like, I don't want to cause difficulties for you. And so you're saying you can't afford this, so maybe I should be the one who should bend, right?
Yeah.
Versus like, I respect that, and I can be very kind, and I'm confident that there are other providers who can, be within that range that you're looking for, right? Like, there are other people, but I think a lot of times, even unconsciously, it feels like, well, no, I should, if someone has come to me, then I should help them.
Mhm.
But it's interesting because I think the other part of it is, I was reading, I don't know if it was like an article a little while back, and they were talking about how, as women, let's say we see a job application, or someone asks us to give a talk, we think about all the things that we don't know, right? Like, oh, like, I don't fully like this criteria, it says 5 to 10 years of experience, I have 4 years, so I shouldn't apply, right?
Yeah.
Or
Yeah.
like, they've asked me to speak about this thing, and I don't know all the research about the topic, so I'm not the
Mhm.
most qualified. But then they were talking about how men typically will look at that and be like, well, I have 4 years of experience, so I'm close to the five, like, I should do it.
Yeah.
And it's so I mean, at least in my thankfully, I have really amazing just male psychologists who I regularly will consult to, and who've actually been such great mentors to me in this
Mhm.
area. but I will hear their thought process and they're like, you are qualified. And, I see myself as qualified. And even if I'm not fully qualified, I know I can do it, right? Like, I know I can get there. Versus
Hmm.
that is a very different approach from when I started off. I was like, no, I need to have God in there and then I can
Hmm.
apply.
Hmm.
Um,
Same, same.
yeah.
Imposter syndrome. I
Yeah.
don't think I've ever talked about this like in public. I had imposter syndrome
Hmm.
when I finished residency. I felt like, especially I'm a DO, and so
Hmm.
as a doctor of osteopathic medicine, it's a little bit of a smaller field. Our residency sizes are a little bit smaller. We don't
Hmm.
work in big academic centers. And so, graduating from a DO dermatology residency, I felt like maybe I don't know as much, or
Hmm.
maybe, I passed the same board exams.
Right.
I did all of that. I studied the same exact textbooks and passed the same exact exams, but I still felt inadequate. And
Hmm.
it took me a few years to kind of get over that. And I think what helped was realizing like everything that actually social media helped a lot because I
Hmm.
saw, other doctors on social media talking about, acne and this and that and all the skincare things. And I'm like, I know everything they're saying. Like I
Hmm.
would say that too. So why am I sitting here thinking that I don't know as much as anybody else,
Hmm.
Um, that helped a lot. And then, of course, positive reinforcement. Like once you start working, you start having
Right.
your patients or your clients, and they tell you like, Dr. Shiva, you helped me so much.
Hmm. Hmm.
And that just feels so good. And you're like, I am making a difference.
Absolutely.
Um,
Yeah.
and I do belong here, and I do have a seat at the table. Recognizing that everybody has insecurities, everybody
Mhm.
feels vulnerable, and it's about how you manage that, what you do, as you said, in that
Yeah,
discomfort, in that
yeah,
uncomfortable moment, what you do. Do you become timid and sit back, or are you like, this doesn't feel great, but I'm going to push forward anyway?
right,
I think
right.
that really helps you to push those boundaries.
Absolutely. So it sounds like for you, and thank you so much for bringing this up, because it's such an important topic. And I think you're right. Like, so even for myself, like, this is not something that we typically talk about. If anything, it feels like maybe we shouldn't talk about, even though there's more and more dialogue around imposter syndrome. I think for so many, I'm like going based on my own experience. It's like, well, maybe I shouldn't talk about this because now I'm a professional and I'm doing things and I shouldn't, speak to it. But it is so important. And so it sounds like for you, what helps, and correct me if I'm wrong, is noticing like, yes, I know this information, but then putting yourself out there, like
Yeah.
actually taking that step, putting
Yeah.
yourself doing the things that you're wanting to do to be able to then improve your confidence in that area, or just to
Yeah.
remind yourself of, your strengths.
Yeah, I think New York City helped a lot.
Okay.
When I first, finished residency, I moved to New York, and I was hustling. Like it's
Hmm.
true, if you can make it in New York, you can make it anywhere. That phrase
Yeah.
is good. I hustled. I would go to different networking events, take my business card, get my name out there, and just speaking about my profession and what I do, and getting that positive feedback really helped. What else helped? It was a lot of just self-work. Like, where does it come from? Like, why
Mm-hmm.
do I feel, recognizing that a lot of what I feel is just like a me problem. It's
Hmm.
not an actual issue. Like, I'm actually
Hmm.
in a great position.
Yeah.
It's just, whether or not I can believe that for myself.
Hmm.
Um, yeah, I'll have
Yeah.
to think a little bit more on
No,
that.
no, no. This is super helpful. I think it sounds like there are just many different steps, right? It was like putting yourself out there, surrounding yourself with other professionals through networking, getting that positive feedback from clients. I oftentimes will talk about how, like, so often when we, with confidence, especially, and imposter syndrome being related, but like, we're waiting to feel confident, right? Like I'm waiting to feel confident, whatever it's about, right? Like
Mhm.
professionally, my way, dating, whatever you want to
Yeah,
say.
yeah,
But we're waiting, but that confidence comes through the experience. It's when we go on that date, when we go apply for that place, that we start to feel more and more confident.
yeah,
And I think personally, but also just in my work, I've seen that when we go in, have that interview, even if it doesn't go well, you're like, okay, it's not as bad as I thought. Like I can cope quite well. And I think that
yeah,
within itself is information, like gathering that objective information
yeah,
versus, what our mind is telling us, or, what it as a professional, what one needs to look like to be a competent professional. That was something that would come up for me. And I think even with social media, like, what is professional? What does that even mean? And I think that's something that's changing so regularly. So just, I think, tuning in for people and seeing what does the objective data tell me, and then taking
Mhm.
small steps and continuing to gather information versus following that story in your mind that's so
Yes,
often
it's just,
inaccurate.
that's all it is a story in your mind.
Yeah.
I one of my first jobs in New York, I was hired at like a multi-specialty practice, and they wanted me to, be their first dermatologist and kind of grow that department. And at first I was like, I can't do this. I'm a new grad. I don't know how to start a dermatology department. I called one of my professors and he's like, you can do it. He's like, I did it. When I finished residency, I started my practice, and, I learned surgery as I went. Like, you'll be fine. And I
Mhm.
did it. And uh, throughout, dealing with that imposter syndrome, those first few years, by year 3, I realized I started from 0 patients, and now my
Mhm.
schedule is full. I must be doing something right, So
Mhm.
exactly, putting yourself out there, taking that risk, taking that chance, um, learning from your experience, and confidence is what you gain from experience.
Yeah.
I recently read something like the life that you're living now is what younger you wanted 5
I
years
know.
ago, you know?
Mhm.
Yeah, I've been dreaming about this day. And the thing is,
Um,
we live our life day to day, and so we don't see how far we've come. But if
yeah.
you really take a second and think about, like, when I was studying for that exam with 0 patients, not even a board
Mm.
certification, right? And
Right.
now where I'm at, like, we've come so far.
Yeah. Oh my gosh. So far. Yeah. And you really are doing it all. I know we're getting close to end of time, but I have one last question. Well, actually, two more questions. But one last question for you as like an entrepreneur and a woman in this space. How has it been for you? You're doing a lot of work, of course, clinically, but also with brands on social media. You have a strong presence, and you're raising a ton of awareness. But how is that for you? I guess, what have you been surprised, putting yourself in that space of working with brands and social media? Are there things that maybe you didn't consider to have been potential challenges that, you've had to cope through, or go, what I mean? What has been, I guess the question is, what has surprised you in that experience of putting yourself out there with social media and working with brands?
What surprised me? So, actually, what surprised me is how much I enjoy it.
Okay.
The
Okay.
beginning, I thought, I don't want to have to dance on
All
TikTok. Like,
right.
I'm a doctor. Like, why do I have to point into the air? Like,
Yeah.
this is so silly, right? And I was so engrossed in just seeing patients and building my practice. I was like, I don't have time for, this whole other thing. But then you start doing it and you're like, this is kind of fun. And I love to educate, right? Like,
Yeah.
I educate my patients. Even growing up, I was always a tutor in medical school teaching the
Mm-hmm.
underclassmen. I have younger siblings that I've taught my whole life. So I love educating in that aspect. And I think it helps me to connect with my patients and just the community. You feel
Mm-hmm.
like you're really helping people, not just, however many patients I see in a day, but, all of my followers too. I'm helping to teach them something. And again, getting that positive feedback, like my friends or my, classmates, people that I know were like, I see what you're doing on social and it's amazing. And I'm like, really? Because I thought that video was so crappy. Like, I
Mm-hmm.
messed up so many times, and they're like, no, it looks so good, right? Like, we are our own worst critic kind of thing.
Yeah. Yeah.
Um, and so, yeah, I actually really enjoy it. I think it's fun. I think it's a really good creative outlet for
Mm-hmm.
somebody that's like stuck in science. It really
Mm-hmm.
lets you be creative and kind of utilize different parts of our brain. I think if I didn't do it, then I would probably fall behind in technology. And, we see like our parents and like the
Yeah.
elders, how they're like, how do you use this iPhone? And
Yeah.
that's going to be us soon, with
Totally.
like Chat GPT. Like, I'm not
I
sure how to
feel,
use that yet.
yeah, I
I
feel
don't
that
know
way
what
about
empathy
TikTok
is.
already. I'm already about TikTok. Everyone's like, come and be like present on TikTok. And I'm like, I honestly have no idea how to use TikTok. So,
It took me so long to figure out Reels, and I'm like, now I have to learn how to make a TikTok. Like,
yeah,
it's,
totally.
but it's good that we are staying up on that technology because
Yeah.
it's only going to get, more and more,
Yeah.
of course. And so, but one thing that, being a female in this business, I will say, one thing I had to kind of get over is, I mean, we're in medicine, we're type A's, right? Like
Mm-hmm.
we are all about perfection.
Mm-hmm. Yeah.
And I'm an Aries, so it's like
Yeah.
perfectionism, I think, is a part of all that. One advice I would give to people that are kind of trying to get started, and what I remind myself is it doesn't have to be perfect.
Mm-hmm.
Like stop criticizing yourself. Talk to yourself the way that you talk to your
I
friends.
love that.
You know,
Yeah.
just post it. Like it's fine. Just post it, and only you're noticing that word that you messed up on, or you don't think the idea is good enough, or the music, or whatever it is. Like, don't worry about what other people are going to think. I used to be like, oh, this is so cringy. Like, I don't want it.
Yeah.
People are going to make fun of it or whatever. No, the people that it resonates with are going to love it. The people that it doesn't resonate with, it doesn't. And you're not going to be able to make everybody happy, but as long as you enjoy it, as long as you feel like you are being your authentic self, you're not faking it and being somebody else or whatever, like you can put your own spin on it. And
Mm-hmm.
that's what I've really enjoyed about the process.
Yeah, no, these are all so important. No, thank you. I feel like, no, you're completely right. If anything, I think when people are actually in their purpose, they're working hard day in, day out, or, they're, living that life is that it's most meaningful to them. Even if they don't like your post, it doesn't resonate with them. They're usually in the, like, good for her. Like, she's putting herself out there. That took a lot of time and energy. And so I think that's also important to keep in mind that, like, even if, they may not like it, but like most times people don't really have a strong negative reaction. I mean,
Exactly.
I will say, I know, I realize those social media with comments and all that can be, at times people will say things they would never say in person, but overall,
Yeah,
um,
I've had trolls. I've had trolls, and I
yeah.
said, "Oh, hey, I guess I'm doing that well that I have trolls now."
Yeah, then you're being noticed for sure. Your audience has definitely grown. No, it's wonderful. And I am so glad that you are in this space because I think, especially with social media, as consumers of it, we need to just be super intentional around what we're taking in. And there's so much
Mhm.
content. And so often people, I see it in the mental health space, and I assume it's the same with dermatology. There are people who aren't professionals or board certified or licensed who are speaking about these things. And so having you in the space, you're allowing us to really get the information of what the science says, and you have the education and the experience to back it up. So thank you
Mhm.
for doing it. One last question. I end with this question for everyone. But what is one piece of advice you would tell your younger self?
One piece of advice I would tell my younger self is when you are afraid that someone is going to judge you, are they judging you or are you judging yourself?
Mm,
So that I think is a really important question to keep in your back pocket. Like whenever you come across any situation where you're like, oh, I don't know, this isn't going to go well, or they're not going to like this, they're not going to like me, or I might not get the job. Like, do you really think that they are thinking that, or are you thinking that?
yeah.
It goes back to what we said. It's all the story that we tell ourselves in our mind. And I wish that I, grew. It just takes time and experience, but I wish I grew into myself earlier because, I mean, that's the advice I would give my
Yeah.
younger self is,
That's
just
such a deep question and such an important question. No, thank you. I feel like you and I could talk about that for an hour. Like it's just
yeah,
there is so much there, and you're so right. I think really just taking the time to ask ourselves that question. What is one piece of advice you would tell her to disregard? It could be maybe something that you regularly heard, maybe a common piece of advice that is typically given, or maybe something you just picked up, right? Like what is one piece of advice you would tell her to disregard?
when I was looking for jobs, I was told, and with good intention,
Yeah.
um, don't ask for too much because
Mm,
you don't want them to then not hire you.
mm,
And I think that is has many sides to it. I think, of course, you want to be realistic, but you also want to be true to yourself and know your worth.
mm-hmm.
So if you feel like a deal or a situation is not fair and it's not valuing you the way that you should be valued, the way that your peers are being valued at, then by all means ask for more, because the worst that somebody can do is say no.
Yeah.
And if they say no, it's what you said. It feels uncomfortable, but that's all it is. It's an uncomfortable feeling that will pass.
Yeah.
So ask for what you want.
Yeah. That no, so good. Yeah. Ask for what you want and they say no, then we know what their limit is. And
Yeah,
then the compromise and the
yeah.
negotiation starts.
I thought negotiation was you ask for something and they say no, and then that's
It
it.
was
Like they
over.
no,
Yeah.
negotiation is actually like
Yeah.
back and forth, right? Like it can keep going.
Communication. Yeah, for
Yes,
sure.
yes. It's not just the A B answer. It's it's not yes or no. It's a discussion, right?
Yeah.
And it's okay for us to have that discussion, even though we're female, even though we're South Asian or Middle Eastern. Like it's okay
Yeah.
for us to discuss things and ask for
Yeah.
what we want.
Yeah. Yeah, no, so true, so true. Well, thank you so much. This was such a wonderful conversation. I feel like there are just so many gems in this that I know when people are listening to it, it's going to be helpful regardless of where they are early on in their career, or even for me, I've just learned a ton from you. So thank you so much, Dr.
I
Karen, for
learn from you
joining us.
every day, so thank you.
Oh, thank you. And let us know, where can people follow you? Where can they find you? If you could just let us know a little bit about your social media and
Yeah,
websites.
my Instagram would probably be the easiest. It's Dr. Mian Skin, DrMianskin.
Okay,
So that would
perfect.
probably be the easiest way. My website is www.drkiranmian.com, DRK, and then my name, KIRANMIAN.com.
Well, thank you so much. I will definitely include that also in the show notes. And so, yeah, thank you again for being here today.
Shiva.
Thanks so much for tuning in to Tell Me Some More with Dr. Shiva. I hope you enjoyed today's episode. If you're enjoying the podcast, it would mean a lot to me if you would subscribe, share, and write me a 5-star review on iTunes so that we can build this wonderful community and support others in living fulfilling lives. Just a reminder that this podcast and the information shared is solely for informational, educational, and entertainment purposes. It's not meant to be a substitute for mental health or medical treatment or advice. If you're looking for additional support in your journey, please seek out a qualified professional. Until next time, everyone, talk soon.